So let us start the theory class number 21, and in this class we are going to discuss about the drug for the diarrhea as well as the drug for constipation as a laxative. So let us start the first under this antidiarrheal or the drug used for the therapy of diarrhea. So let us start the diarrhea. So first we have to know about the diarrhea. What is diarrhea? So it is nothing, it is only the frequent passage of feces which is liquid in nature, and this frequent passage of liquid feces as a result of imbalance between the secretion and absorption of fluid and electrolyte. If this imbalance between secretion and reabsorption occur, it may lead to the diarrhea in which you will find the liquid feces, and that is frequent in nature. If the nature of the diarrhea is acute, so at that time this become very tough to manage it, but it is chronic, then it is rather it will take the time, but not much difficult to control it. I mean particularly when because of the acute diarrhea, it will lead to deficiency also. So what about the deficiency? Deficiency about the fluid and the electrolyte. So now we have to discuss about the fluid and electrolyte. So before going to discuss about these fluid and electrolyte, we have to go through the factors which is responsible factors in diarrhea. So regarding factors in diarrhea is concerned, in this diarrhea, you will find the frequent passage of liquid feces, and this may be because of the increase in GI motility or gastrointestinal tract motility, and also it is imbalance between the fluid and electrolyte secretion as well as the absorption. Therefore, these are the main thing which is responsible for the diarrhea. Now we have to go through the causes of diarrhea, and we will find there are several causes of the diarrhea, like this may be because of the infection of GI tract which leads to diarrhea. This may be because of the poison or toxin. This may be because of the anxiety. This may be the use of the different type of broad spectrum antimicrobial agent which produces diarrhea. So there are various causes which produces the diarrhea, and accordingly as per the cause we have to treat the diarrhea. I mean, if the diarrhea because of the infectious agent, then we have to use an anti-infective agent. If the diarrhea is because of the toxin, we have to remove the toxin. So as per the cause of the disease, like diarrhea, we have to use the drug accordingly to treat the diarrhea, or we have to manage the diarrhea. Like if the diarrhea will produce fluid and electrolyte losses, so we have to treat the fluid and electrolyte imbalance. So this is very, very important, particularly diarrhea of acute in nature. So if acute type of diarrhea is there, then we have to be cautious about the therapy by using the ORS, oral rehydration salt. So now we have to go through the classification of the drug that we are using as an antidiarrheal drug. or you can say how we have to manage the diarrhea. So now we have to go through the classification of antidiarrheal agent or drug or the management of the diarrhea. Now we have to discuss one by one. That we already discussed in case of the diarrhea, the motility of the gastrointestinal tract raised. So we have to reduce it. Motility, we have to reduce it. So this one way of the therapy. If there is toxin in the GI tract, then we have to use to adsorb the drug which adsorb the toxin like adsorbent. The adsorbent may also coat the mucosa of gastrointestinal tract. So, accordingly, we have to treat the disease diarrhea as per the mm, cause of the diarrhea. So, now we have to classify the antidiarrheal drug or the management of diarrhea. In this, the most important is the fluid therapy. If the diarrhea is of acute in nature, then we have to first go through the fluid and electrolyte therapy. So the first one for the diarrhea management is fluid and electrolyte treatment, and particularly for animal therapy, we also have to see whether the animal is going to take the drug either through oral route or not. If not, then we have to administer the drug by other route like the parenteral route, particularly intravenous administration. Take the example in case of ruminant. So in case of ruminant, rather we prefer to give the oral rehydration salt if we have to give through the intravenous route. Like normal saline, we have to administer like that. So for fluid and electrolyte loss, particularly in large animal, we have to treat the large animal by intravenous administration of the drug. And like the animal dogs and cats, we have to use the drug through oral route also. For that, we have to give the ORS. So what is this ORS? Oral rehydration salt. What are the components this oral rehydration salt have? The electrolyte, the that or fluid that lost in case of acute diarrhea, we have to go to give that only that type of the electrolyte, like sodium chloride, like potassium chloride. To balance the acidity, we have to give the sodium citrate, then we have to also give the glucose. So in case of oral rehydration salt, the component are, as per the World Health Organization, the component are sodium chloride 2.6 gram, potassium chloride 1.5 gram, glucose 13.5 gram, and sodium citrate 2.9 gram. And we have to dissolve these all in 1 liter of sterile water, and then we have to give to the patient, whether it is animal or human being. Now we have, so this is all about the fluid and electrolyte treatment. Now we have to go through the other way of the therapy. As we know, in case of diarrhea, there is increase in secretion, there is or imbalance between the secretion and reabsorption of fluid and electrolyte, and there is increase in motility. So we have to give the drug which reduces, decreases, or inhibiting the motility, and as well as under the same, as we know, we have to use to reduce the motility by giving the drug that we call it antispasmodic and anti-secretory. So under this first, the drug that we have to give for the therapy of the diarrhea is called anti-motility, anti-spasmodic, and anti-secretory drug. So under this, we have to go one by one. So the drug which that we have to use is called anti-motility drug. So in this first, regarding the anti-motility, anti-spasmodic and anti-secretory drug. To reduce the motility, or you can say the peristaltic movement, we have to give the drug like we call it opioids analog. So opioid analogs are the drug that are acting on the opioid receptor. And as we know, when we are using the drug for the therapy of the pain, for the management of pain, that like the morphine, their side effect is constipation. So here we are going to give the drug which is acting on the opioid receptor, and therefore it is reducing the motility. So anti-motility opioid analogs. If we go through the mechanism of action of the opioid analog, the opioid analogs is acting on the central and enteric nervous system through the opioid receptor. It may be the mu or it may be the delta receptor. So opioid analogs are widely used drug, and its mechanism of action or their mechanism of action is through the enteric nervous system, or you can say the central nervous system, and by which means they are going to decrease the secretion of neurotransmitter acetylcholine. So opioid analog decreasing the level of acetylcholine neurotransmitter, and because of this reduction in acetylcholine secretion, it will also reduce the motility, as well as it also inhibits the secretory motor neuron. Under this opioid analog, the drugs are loperamide, diphenoxylate, diphenoxine, codeine. So if you go through the mechanism of action of these all opioid analog, they are having the same mechanism of action. They are acting through the opioid receptor, and therefore it decreasing the level of acetylcholine. Therefore it reduces the secretion, as well as it also decreases the contraction of the smooth muscle of the GI tract, and therefore it decreases the motility of the GI tract. And these are very much used drug, widely used drug, like loperamide and diphenoxylate. So these two are anti-motility opioids analog and very much in use. So be cautious. So we have to recall at least this one. And regarding the mechanism of action is concerned, that we already mentioned, it is activating the presynaptic opioid receptor in enteric nervous system, and therefore decreases the acetylcholine release, as well as it and therefore as a resultant decreases the peristaltic movement. The dose for which we are using, I mean for anti-motility, they lack analgesic effect. So this is very, very important. And regarding the side effect of the opioid analog is concerned, it produces drowsiness, abdominal cramp, dizziness. So this is the side effect. Other side effect concerned to this opioid analog are, this is going to widen the colon. So this will produce the megacolon, particularly in the young children and young animal. Therefore, opioid analog for long time therapy, it is not to be prescribed for children as well as for the young animals, because this is going to widen the colon, and therefore we call this condition is the megacolon. As well as we are not going to use this opioid analog in case for the therapy of severe colitis patient. In this we are not going to use the opioid analog. Another opioid analog, that is called resicadotril. So resicadotril is a prodrug, first important thing. This is also a upward in analog, but its mechanism of action is quite differ from the mechanism of action of upward analog like loperamide and diphenoxylate or diphenoxine or codeine. How this Resicadotril is acting, because this is also upward analog, but its mechanism of action is quite different. How this drug is acting? This drug is actually an enzyme inhibitor. Which type of enzyme this drug is inhibiting? The drug inhibits the enzyme that degenerate the endogenous enkephalin. So what is this endogenous enkephalin? That is the opioid, that is the endogenous opioid, and relieve the pain like dynorphin, enkephalin, endorphin. These all are the endogenous opioid and relieving the pain. So, what this resicadotril is doing, resicadotril is an enzyme inhibitor which destroy the endogenous opioid enkephalin. So, therefore, when resicadotril inhibits the enzyme enkephalinase, therefore, enkephalin will not be degenerated, not be breakdown, and therefore enkephalin action is persisted for longer time, and therefore it reduces the motility. It is acting through the mu and delta opioid receptor, and the similar to the opioid analog, this is anti-secretory and anti-motility. So this is all about the opioid analog and prodrug opioid analog resicadotril. Regarding the loperamide is concerned, it acts through both mu receptor and mu and delta receptor. Now, under the same, the drug which reduces motility, drug that reduces the secretion, and as well as we are going to discuss the drug that reduces the spasm, that reduces the contraction of the smooth muscle of the GI tract. So anti-motility, anti-spasmodic, and anti-secretory. Under this that we have discussed opioid in analog, that is particularly anti-motility and anti-secretory. Now we have to go through the drug which is particularly acting on the spasm, or that reduce the contraction of the smooth muscle of the GI tract. That is called the anti-spasmodic. Or you can say the drug that inhibit the action of neurotransmitter acetylcholine on its receptor, particularly the muscarinic receptor. For that we have to use the drug which call it the anti-muscarinic or muscarinic blocker. So the second one under the same anti-muscarinic is anti-spasmodic is muscarinic receptor antagonist. So muscarinic receptor antagonist, that is also a direct acting muscle relaxant. Under this the example are that we all are aware about this drug, that are atropine, hyoscine, propanthelene, and dicyclomide. So these all are muscarinic receptor blocker. Regarding mechanism of action is concerned, the drug is itself telling the mechanism of action, means the drug is blocking the receptor muscarinic. So how the drug is producing this action? As we know, the neurotransmitter acting on the smooth musculature of the gastrointestinal tract, the neurotransmitter acetylcholine is binding to the muscarinic receptor of the smooth musculature of the gastrointestinal tract, and therefore it increases the motility of the contraction, and therefore increases the motility. So what this drug is going to do, because the drug is the muscarinic blocker, so the muscarinic receptor is occupied by the blocker. So this receptor is occupied by the blocker, so there is no place for the neurotransmitter acetylcholine to bind with the muscarinic receptor to produce the contraction of the smooth muscle of the GI tract. So in place of acetylcholine, the blocker get occupied, and therefore acetylcholine is not able to produce its action. So this is called antispasmodic muscarinic receptor antagonist. So therefore it decreases the intestine spasm. Under the same antimotility, antispasmodic, antisecretory, the second is the alpha 2 adrenergic receptor agonist. So this under this alpha 2 adrenergic receptor agonist, the drug is clonidine. So what is clonidine? Clonidine is a alpha 2 adrenergic receptor agonist. So and this drug clonidine is anti-secretory and anti-motility action. So this is all about the drug that are coming under the anti-secretory, anti-motility and antispasmodic, particularly anti-motility and anti-secretory. So this alpha 2 adrenergic receptor agonist is a anti-secretory as well as the anti-motility. How this drug is acting? It is acting through the enteric neuron or enterocyte and inhibiting the fluid and electrolyte secretion. So and therefore it also increases the intestinal transit time. I mean bowel, that is the food content of the GI tract, is reducing its frequency of evacuation. Where this drug we have to use in chronic diarrhea along with the diabetes. So for that therapy we have to use this alpha 2 adrenergic receptor agonist. Now we have to go through the other antidiarrheal agent. If the diarrhea is because of infection, so we are going to use antimicrobial agent, that is also called anti-infective agent. For that, the diarrhea because of the infection, we have to use anti-infective agent, that is the antimicrobial agent, that is the antibiotic, or ciprofloxacin, doxycycline, then metoclopramide, metronidazole, ciprofloxacin, doxycycline, metronidazole, erythromycin, and other antibiotic may be used under the anti-infective drug used for the therapy of diarrhea. So this is all about anti-infective drug used for the diarrhea. Next is the drug that we call it adsorbent and used for the therapy of diarrhea. So adsorbent is telling how the drug is acting. It is adsorbing. Adsorbent means the agent which is adsorbing. What this is going to adsorb? It may adsorb the fluid present in the lumen of the GI tract, and therefore it reduces the frequency of the feces coming out. So under the adsorbent, the drug are kaolin, pectin, charcoal, methyl cellulose, activated etapulgite, magnesium aluminum silicate. They are widely used to control the diarrhea. Regarding mechanism of action is concerned of these adsorbent, that the name is telling they are adsorbing the things present in the lumen of gastrointestinal tract. It may be the fluid, it may be the toxin, it may be the microorganism. Not only these adsorbing, but also it is coating over the mucosa of gastrointestinal tract, and therefore it is protecting the intestinal mucosa. And this about the drug that we are discussing the drug under the same adsorbent, we are also using the drug like bulk forming or hydroscopic agent. So what is the function of that one? This is also adsorbent, absorbing the things present in the lumen of GI tract. It may be toxin, it may be fluid, it may be microorganism, and it may coat the mucosa of the GI tract. And under this bulk forming agent, the drug that we are using also for the purgative is isabgol. Isabgol is also called spagula or calcium polycarbophil. These are also to be used for to control the diarrhea. How? Because they are adsorbent, they are hydroscopic in nature. So whatsoever the liquid, whatsoever the fluid present in the lumen of the gastrointestinal tract, this is going to adsorb it, and therefore it gives the bulkiness, as well as it will reduce the frequency of feces come out. No doubt this is act as a purgative, but the frequency of the feces coming out, that is going to be reduced because they are absorbing the water, and as well as the watery nature of the diarrhea is also going to be reduced. So this is about the drug under the adsorbent, the example that we already discussed. Now we have to go through the agent that re- reduces the inflammation. So as we know, if there is inflammation of the mucosa of the gastrointestinal tract, it may be one of the region of the diarrhea. So for that, we have to reduce the inflammation. So even that non-steroidal anti-inflammatory drug like indomethacin and aspirin, because of their anti-inflammatory activity, we may be used to control the diarrhea, particularly diarrhea concerned to the inflammation of the gastrointestinal tract. But this one is not much in use, and this is classified under the agent that modify the fluid and electrolyte transport, and the drug that we already discussed. But in this agent which modify fluid and electrolyte transport, one drug is the very important drug, that is the bismuth subsalicylate. Bismuth subsalicylate is anti-secretory, anti-inflammatory, as well as the antimicrobial agent, and to be used for the therapy of the diarrhea. So this is very important drug, belongs to the agent that modify the fluid and electrolyte transport. Now we have to go through the two or three more classification under the diarrhea, antidiarrheal agent, is the drug like somatostatin analog. So as we know, the somatostatin is inhibiting the secretion of gastrin. How the somatostatin is producing the action? Somatostatin is reducing the secretion of gastrin or 5-HT, or you can say cholecystokinin, and therefore by this means they are potent anti-secretory and anti-motility action. How this somatostatin is acting? This is going to reduces the gastrin or inhibiting the gastrin. So therefore the gastrin is acting directly on the enterochromophene like cell as well as the parietal cell, and therefore in as a resultant it increases the gastric particularly the HCl secretion from the parietal cell, and also reducing the 5-HT. So therefore, because these two means, by inhibiting the release of gastrin and 5-HT and cholecystokinin, inhibiting the secretion as well as reducing the motility. Under this, the drug are octreotide and itself somatostatin, but mainly we have to use the octreotide as a antidiarrheal agent, that is the somatostatin analog. Next is the, if the diarrhea is because of the bile acid, if the diarrhea is because of the causative agent of the diarrhea is the bile acid, then we have to sequester or remove bile acid, so we have to use the either sequester which remove the bile or the binder which remove the bile acid, that we have to use the drug. So for bile acid sequestrant, we have to use which remove the bile acid by binding to this bile acid, as well as it also remove the bacterial toxin. So the drug under the bile acid sequestrant are choline, cholestyramine, cholecystipol, cholecalciferol. So these three are the bile acid sequestrant. And the last one is if the diarrhea causative agent is because of the use of broad spectrum antibiotic. Broad spectrum antibiotic it itself leads to diarrhea. How? If we are using chronically antibiotic, broad spectrum antibiotic for chronic treatment or long term treatment, this is going to produce the secondary type of infection which lead to the diarrhea, like the infection of Clostridium difficile. For that, we have to use the probiotic. Probiotic like dahi, or that we, as a species, you have to use lactobacillus, or you have to use the Saccharomyces boulardii. So this is the probiotic used to treat the diarrhea associated with the use of broad spectrum antibiotic for long time treatment. So we have to use. So this is all about the classification of the antidiarrheal agent. Now we have to go through the drug which particularly used for the therapy of the constipation, that we call it the laxative or cathartic. So the drug that remove the constipation are called the laxative or cathartic, or you can say purgative, or you can say evacuant, or you can say aperient. So the terminology like the laxative, cathartics, purgatives, aperients, and evacuant, these terminology are interchangeably used. Only to minor degree there some differentiation is there. See here, if you are using the drug to evacuate the bowel from the gastrointestinal tract, or to remove the undigested material from the GI tract, that we call feces, the definition about the laxation for which we are using the drug laxative. So laxation is the evacuation of the complete formed stool or fecal material from the rectum is called laxation, whereas the cathartic is somewhat removing the unformed watery fecal material from entire colon is called cathartic. So see here, only the difference is that in cathartic they are removing the watery fecal material which is unformed from entire colon. So there are very minor difference between these. So first we have to define the laxative or the cathartics, or the drug that is used for the therapy of constipation, which is telling the definition. So laxative or cathartics are the drugs or the agent which promote the defecation by enhancing the frequency of defecation by increasing the fecal volume as well as the consistency is called laxative or cathartic, or simply laxative are the drug which accelerate the removal of food from the GI tract is called laxative. So this is about the definition of the laxative or cathartic. So therefore it removing the constipation. So that is promoting the drug, promoting the easy defecation is called the laxative. How this will attain this problem? How this process to be fulfilled by enhancing the motility, or you can say the frequency of defecation, or increasing the fecal volume, as well as changing its consistency. means ki more watery, less solid. Why? Because as we know, for the stool, the major chunk in the stool is the water content. So water content of the fecal material is participating about 70 to 80%. So 70 to 80% of the fecal material is the water. So if the water in the fecal material is less, then this is going to create the constipation. So we have to enhance the water content in the fecal material, and it will helps to easy remove out from the GI tract, gastrointestinal tract, and it will not leads to the constipation. So we have to change the consistency of the fecal material to make it the complete evacuation. And what are the other conditions where we have to use this laxative or cathartic? When we are performing the surgery, so before performing the surgery we have to remove the bowel by using the drug as a laxative or cathartics, or when you are going through the radiological examination of the GI tract or endoscopic examination of the GI tract. So we have to remove the bowel from the gastrointestinal tract, or you can say empty the colon, which is desirable for under this condition. For that we have to use the laxative or cathartics. So this is about the few line about the cathartic or laxative. Now we have to go through the mechanism of action of these drug, as that we have to use the as a laxative or cathartic. So if we see what is the function of these laxative and purgative, so main purpose is to increase the fluid in the lumen of the GI tract. So, if intraluminally, if the amount of fluid is retained more there, then because of the retention of the fluid intraluminally, it will increase the volume of the fecal material or the bowel because of retention of the fluid, and because of its pressure, or you can say the weight, it is acting on the musculature of the GI tract, and therefore it increases the peristaltic movement. So therefore, to retain more water in the lumen of the gastrointestinal tract, we have to use the drug which is hydrophilic in nature, which have to use the drug which withdraw or withheld the water, or you can say the fluid in the lumen of the GI tract, which help in retention of the fluid in the lumen. Or if we reduce the absorption of fluid from the lumen, even we are inhibiting the or the checking the or the reducing the or we decreasing the net absorption of fluid present in the lumen of the gastrointestinal tract. Therefore again it increases the volume or amount, and therefore it make the pressure, it make the weight on the muscular of the GI tract, and therefore increases the motility to evacuate the bowel from the GI tract. As well as this way, other way, we directly act, the drug has to act directly on the musculature of the GI tract to increase the motility. So for that we may, or if there is a contraction of the musculature is non-propulsive type or segmenting type, then we have to inhibit this motility, and we have to make it propulsive to evacuate the contraction and remove it. The drug as a laxative and cathartic that we are using, they may are osmotic in nature to withhold the water in the lumen of the GI tract, and also they are also possessing action to increase the activity of nitric oxide synthase enzyme to give rise in nitric oxide, as well as it enhances the biosynthesis pathway of platelet activating factor. So what is the role of nitric oxide and platelet activating factor to combat the constipation? platelet activating factor is actually pro-inflammatory mediator, and this platelet activating factor is stimulating the colonic secretion and therefore increasing the GI motility. Whereas nitric oxide is also stimulating the intestinal secretion and inhibiting non-propulsive or segmenting contraction of the GI musculature and make it the propulsive type, and therefore helps to evacuate the bowel from the GI tract. Now, based upon this mechanism of action, we are going to classify the drug that we call laxative or cathartic. So, classification of laxative or cathartic based upon the mechanism of action. Now we have to go through the first one, that we call it the drug, that all the drug under this, they are mainly going to increase the or withhold hold the water in the lumen. They are not going to act on the mucosa. They are mainly having the property to retain the fluid and electrolyte in the lumen. So therefore they are called luminally acting laxative or cathartic or agent. Under this luminally acting agent, the drug are again subtype. They are called bulk forming agent or hydrophilic colloid. They are called osmotic agent. They are called also the third one is the third one is the stool wetting agent or surfactant and emollient. So these all are the drugs that are acting intraluminally, particularly to keep or retain the water, or you can say fluid and electrolyte in the lumen of the gastrointestinal tract. They are very meager value to act on the mucosa of the gastrointestinal tract. Therefore, they are intraluminally acting. Under this, that first one is the bulk forming agent or hydrophilic colloid. In this, the agent regarding the mechanism of action of these are concerned. Their mechanism is their action is holding the water, holding the fluid as well as the electrolyte. So when the fluid hold by this bulk forming agent, the name is telling, after holding the water, fluid, electrolyte, it make voluminous. So this is called bulkiness, and because of the bulkiness, it will give rise the pressure on the musculature of GI tract to increase the motility to evacuate the bowel. So this way this is going to act. Under this, the drug are agar, bran, psyllium preparation, methyl cellulose, and calcium polycarbophil. All these agents are fiber in nature. So these all are the fiber in nature. So how they are acting? They are giving the bulkiness. They are also going to, because they are holding the water, so this is going to make the fishes soft, and they are holding the water, so it is hydrated. So because of this, the fiber is holding the water and also less digestible, so it hold that, and usually those fiber which contain higher amount of lignin, they are less digestible, and which helps to increase the stool bulk and helps to transit it from the gastrointestinal tract. Say in the roti, wheat bran, they are high in lignin. They are helping to hold the water. The best one example is psyllium husk. This is the most usable drug I have to remove the constipation for the older patient. That psyllium husk is isolated from the seed of the plantago herbs. That is the plantago ovata. We call it isabgol and ispagula. And this is most of the preparation that is used for the constipation therapy that is present there. And other that are semi-synthetic celluloses are methyl cellulose, hydrophilic resin, that is calcium carbophil. So this is also coming under the bulk forming agent or hydrophilic agent. The second one is the osmotic agent. The name is telling its mechanism of action. How these drugs are acting? Because these drugs are creating the osmotic pressure. Because of the osmotic pressure, because of the hypertonic nature, they are absorbing the fluid from the surrounding of the lumen, and therefore when water is coming at that area where the drug is there, because of osmotic pressure, the water, it retains the water there in the lumen of the gastrointestinal tract, and therefore they are going to retain the fluid, make the much volume, bulkiness, make the stool soften, and it helps to transit the bowel. Under this osmotic agent, this type of property possessed by saline salt, and we called it saline laxative. So saline laxative are usually magnesium cation and phosphate anion. So therefore they are called saline laxative, like magnesium sulfate, magnesium hydroxide, magnesium citrate, and sodium phosphate. Their mechanism of action we already discussed. By its osmotic action, it retains the water, and therefore it increases the peristaltic. Because of the retention of water, it gives rise the more amount volume. It give pressure over the GI tract, and therefore increases the motility to evacuate the bowel or transit the bowel. So regarding the caution is concerned, for this magnesium and phosphate, that we have to use it with caution in the patient which is suffering from renal insufficiency, cardiac disease, and as well as pre-existing electrolyte abnormality, or in diabetic patient, constipated diabetic patient. Now we have to go through under the same, and after the osmotic, under the saline laxative, under the osmotic agent, another one is called non-absorbable sugar or alcohol. So non-absorbable sugar or alcohol, under this the example that is also coming under the osmotic agent, that means they are creating again the osmotic pressure to hold the water, retain the water, and stimulate the peristaltic, are lactulose, sorbitol, and mannitol. So these three are used, and therefore how they are acting? They hydrolyzed in the colon and form the short chain fatty acid, stimulate the clonic propulsive motility by osmotically withdrawing or drawing the water, holding the water, retention the water in the lumen, and therefore increasing the motility to evacuate the bowel from the GI tract that we already discussed. This lactulose as well as the sorbitol is we have to use for the constipation caused by the drug opioid and vincristine. So the constipation caused by opioids and vincristine is by treated by using this non-absorbable sugar lactulose and sorbitol. Also it to be used in the treatment of constipation for elder patient and idiopathic chronic constipation. So this is very very important. Lactulose is also used to treat hepatic encephalopathy. One very important osmotic agent, osmotic drug, is PEG, polyethylene glycol electrolyte solution. This is very much used to evacuate the bowel from the GI tract from the same mechanism by holding and withdrawing the water in the lumen and increasing the peristaltic movement or motility, and this particularly PEG, polyethylene glycol, is used for cleaning the colon, particularly for radiological examination, particularly for before performing the surgery, or for endoscopic examination, we have to use the PEG. The mechanism of action is the same. And now the last under the luminally acting laxative or cathartic is stool wetting agent, or stool wetting agent is also called surfactant and emollient. So what is the meaning of surfactant? The agent or the chemical or the drug which reduces the surface tension. And emollient means it softens the material. It's called emollient. So under this the example is docusate salt. Docusate salt like docusate calcium, docusate sodium, as well as the mineral oil. So mineral oil and docusate salt like calcium and sodium salt is surfactant and emollient agent. So name is clear cut indicating the mechanism of action. How this drug is acting? They are called docusate salt, sodium and calcium is an ionic surfactant which lower the surface tension of the stool. So when the surface tension of the stool get reduced, it helps to allow to mix the aqueous and fatty substance. I mean, when the surface tension of the stool get reduces, which allow to helps to mix the water and fatty substance with the stool, and therefore the stool becomes softened, and therefore when the stool becomes softened indicating much water holding and helps to easy defecation or remove the bowel or transit the bowel. So this is also helps to increase the intestinal fluid and electrolyte secretion, and therefore under this the another drug is mineral oil. Mineral oil is also going to perform the mechanism of action because this is oil in nature. So when oil is going to mix with the stool becomes softened. So when the stool becomes softened, it helps to be easy evacuate. And the one side effect, very important side effect, is associated with the mineral oil because it is a fat. So fat soluble vitamin is get dissolved in this mineral oil, and it will remove from the fecal material and therefore produces the vitamin deficiency, particularly the fat soluble vitamin. Not only that, the another side effect is it produces the leakage of oil from the anal sphincter. So this is another side effect. This is all about the drug which is coming under the luminally acting laxative or cathartic. Now we have to go through the irritant or stimulant laxative. So irritant or stimulant laxative, this is non-specific one. So we are calling it the non-specific irritant or stimulant. Name is indicating the mechanism of action, means that these drug under the irritant or stimulant irritating the mucosa of the GI tract, producing the low grade of inflammation or irritation to the mucosa of the GI tract, particularly the small and large intestine, and therefore because of the inflammation it promote the accumulation of water and electrolyte, or you can say fluid and electrolyte, and therefore it increases the intestinal motility to evacuate the bowel. So this is about the irritant and stimulant. Under this the drug are coming under different group. We call diphenylmethane derivative, we call anthraquinone or anthraquinone laxative, we call castor oil. So these all are coming from the irritant or the stimulant. So their mechanism of action, because of its low grade of inflammation, these drug is promoting the accumulation of the fluid and electrolyte in the lumen of the GI tract, and therefore it is increasing the motility to evacuate the bowel. Under the diphenylmethane derivative, example are bisacodyl. So bisacodyl, one of the very much used drug as a suppository. So what is suppository? Suppository are the drug that we have to make it in a conical shape, in a semi-solid form, and we have to insert through the rectal route, and at the rectal temperature this drug get melt, and because of its irritant action this is going to produce the remove the bowel, particularly from the lower end of the colon. Under this, another drug is phenolphthalein, but it is carcinogenic, oxyphenicitine, but it is hepatotoxic, then sodium picosulfate, and this sodium picosulfate is hydrolyzed by the colonic bacteria into its active form, and locally it acts as a low grade, producing low grade inflammation. And so the drug is directly acting on the enterocyte or enteric neuron, and GI, smooth muscle. Regarding the side effect is concerned, this is going to produce cramp and excessive fluid secretion. Next, under the same is the irritant, or you can say stimulant, is the anthracunons. So anthracunons, when it is monoanthrone, so this is irritating in nature. Usually, when the in drug form, this monoanthrone is the drug is not found in the monoanthrone form. It is found in the dianthrone form. So when we are taking it through the oral route by colonic bacteria, this get converted into monoanthrone, and the monoanthrone, or you can say the monoanthrone, is actually active component and irritant in nature, a stimulant in nature, and producing the purgative action or laxative action or cathartic action. The mechanism of action we already discussed. It produces colonic contraction, induce water and electrolyte secretion. Under this, the anthraquinone or anthraquinone laxative, the drug are allo, cascara, sina glycoside. These all are having the active constituent that is the contain imodine. And actually, this sena is actually these all sena is a glycoside. So anthraquinone, when it become active, this active by the colonic bacteria by converting into the monoanthrone from the dimeric dianthrone or glycosidic form. So glycosidic form or dimeric dianthrone is get converted into monoanthrone by the bacteria, colonic bacteria, and therefore become active and producing the irritant action or a stimulant action. Another one example from the same group is castor oil. This castor oil possessing one toxic component, we call it ricin. This is toxalbumine. And because of this toxicity, the castor oil is not nowadays in use. They contain the one component, we call it the triglyceride of ricinoleic acid. So this triglycerides of ricinoleic acid is actually the component for producing the irritant or stimulant action. So when we are taking this castor oil, this triglyceride of ricinoleic acid get converted into active agent, particularly this triglyceride get removed the ricinoleic acid, I mean ricinoleic acid get freed, and by the action of enzyme lipases, and therefore ricinoleic acid is producing the stimulating action to increase the secretion of fluid and electrolyte and increase the intestinal motility and increase the intestinal transit. So triglyceride of ricinoleic acid is become active when taken orally by the enzyme lipase, and therefore it producing its mechanism of action. Now the another laxative are prokinetic. So we already discussed under the prokinetic. This we already discussed prokinetic. That is the 5-HT4 agonist, tegaserot and cisapride. We also under the prokinetic discussed dopamine 2 receptor antagonist, domperidone and metoclopramide. We also already discussed motolite. So you have to see the previous YouTube, that is about the Motilite. And the last one under this is the Enema and suppository. So what is enema? Enema is nothing. This is the liquid preparation that is having the irritant in action, and this enema is the liquid component, and we are inserting through the rectal route, and therefore it distend the colon, distal part of the colon. Because of the distension of the distal part of the colon, it is going to helps to evacuate the bowel by its reflex action, because it is distending the colon. So enema is the liquid preparation. We are inserting through the tube, through the rectal route, and this is particularly used for the cough, which in which they are suffering from the constipation. So the constipation of the cough should be removed by using the enema. In enema, we are using the liquid preparation, inserting through the rectal route tube, and it distend the distal part of the colon. Because of the distension of the distal part of the colon, by its reflex action, this is going to evacuate the bowel, and for that we may use also the normal saline along with the soap. So this is called enema. Whereas the suppository is the solid, semi-solid medicinal preparation, inserting through the rectal route, and at the rectal temperature, this solid preparation get melt. And because like the biscodil is coming in the trade name Dulcolex, and that at rectal temperature it melt, and because of it irritant action, this produces the evacuation of the bowel. So this is all about the antidiarrheal agent as well as the drug used for the therapy of constipation.